Thank you. So I'm really excited to introduce this panel where we'll focus on unpacking the innovation pipeline in the treatment of substance use disorders. But before I introduce our speakers, what I wanted to do is sort of set the context by giving you a little background on some of the work we're doing in early stage development work in developing a digital therapeutic for individuals with co-occurring substance use and mood disorders. So when we think about this innovation pipeline, I'm starting you off at the very beginning of this pipeline. So to give you some background, in 2017, we put a team together of researchers and clinicians from our McLean Hospital programs that treat substance use disorders. And we competed in the Partners Connected Health Innovation Challenge. And the challenge really had two components. One was to identify a problem, and two was to propose a technology-enabled solution to that problem. And as you can probably guess from the photo and the fact that I'm talking to you about this, we did indeed win the challenge. So now we are in the position to bring our idea to life. So the problem that we identified is one that we often see clinically. So we framed it in the terms of this case composite of this woman that we'll call Amita. So Amita is in her mid-20s, she has depression, she's using opioids, and she gets stuck in this cycle where she goes into treatment. The treatment addresses her substance use, it talks about her opioid use, but it doesn't address her depression. So she leaves treatment, and she's out on her own, sort of struggling with minimal support, and she gets stuck in this cycle. So where we thought technology could be useful was in these two areas. We think technology can improve and provide more comprehensive treatment for Amita and also help extend treatment beyond the clinical setting, so out there where she's struggling. As everyone in this audience knows, this Amita story is not rare. There are millions of people suffering from co-occurring mood and substance use disorders. We know that they're less likely to complete treatment. And like Amita's story, they generally receive treatment for either the mood disorder or the substance use disorder, but most of them aren't getting integrated treatment for both of the disorders. So this is an area where if we can find a solution, we could potentially make a big impact. So we do have an integrated group treatment called integrated group therapy, or IGT, that we've used. It's evidence-based treatment for people with co-occurring mood and substance use disorders. It was developed by Roger Weiss and Hilary Connery, and it focuses on teaching people to self-monitor both the mood and substance use symptoms to see the relationship between the two. There's teaching coping skills training, and also some education about the relationship between the two disorders. So this is a treatment that's, it's a group therapy. It's delivered generally once a week in a 1-hour session for 12 weeks. The problem is that it's not widely available. So there are many programs that don't offer IGT, and even when they offer it, it doesn't really mean it's accessible to everybody. There may be people who have conflicts and can't attend that 1-hour group at that time, or people might just not feel comfortable in group therapy settings. We know that treatment programs generally tend to be predominantly men, so a woman like Amita may not feel comfortable in a group that is 90% men. So even when it's accessible, it's not always available for everybody. It also doesn't address that component on the cycle of when Amita's out there struggling in the real world. So there's no in-the-moment support provided besides that once-a-week group. So there are several ways that we thought we could take IGT and create a digital platform. We could have daily mobile check-ins to look at mood and substance use disorder symptoms. We could digitize the skills practice. We could have maybe a peer group online support component, progress tracking, giving people feedback about how they're doing, some coaching, some motivation. So these are all ways that we could take components of IGT and digitize it. Where we're at now is that we are looking to develop a minimum viable product, our MVP. So we're not going to take all those components from the previous slide and just put them into a platform. What we've done is we've conducted interviews with patients and providers, people who will be using this tool to get information about what are the key components, what is the need really. And we've compiled that feedback to inform our design, and we're working with the Partners Healthcare Pivot Labs which was previously Partners Connected Health Innovation, and we have a great team there helping us to create this MVP. So this is our initial design, what we've come up with from compiling the information. We're calling our platform Integrated Support Now. There'll be an initial onboarding when people log in to get some information about their motivations for recovery, their goals. We'll have that check-in component, some education about IGT and the relationship between the two disorders, and then we'll focus on some key skills. So what we have here is our fast forward skill, which in the original manual was called play the tape forward, but we weren't sure if younger generations knew what a tape was, so we changed that to fast forward to be more relatable, which basically teaches people to think through the long-term consequences before making a decision. And so what we do is once we create a clickable prototype, then we're going to have some iterative feedback sessions to create the MVP. So I want to end with discussing some of the challenges that we face. So this is, as Justin was saying, what are the risks in this development process? And some of these have already been touched upon in the earlier panels. But the first thing is, will anybody use this? We think this is a great solution. We hope people will use it, but will they? And if they do, how much will they use it? How often will they engage in it? We know that with mobile apps, engagement can drop pretty quick. But we also don't know quite what is the optimal engagement for someone to receive benefit. We are also taking an evidence-based treatment and translating it to a digital platform. So what might get lost in that translation? What are there essential elements that we're taking out that would make it less effective? This was discussed earlier in the morning about clinician involvement. Should we have clinician involvement? And if so, how would we integrate that into their workflow so that it's not burdensome? How would we scale it up? With mobile platforms, there's always a concern about privacy and safety. We want to make sure this is a safe experience for users. And the ever-present question of how will we fund it? How will we sustain it? How will we deal with maintenance costs? So I know I started off with this proposed solution, and I've ended with more questions than I have answers to, but I hope this gives you an idea of how complex this process is, particularly in these early phases, and I'm really looking forward to handing it over to my fellow panelists who are further down in this pipeline and can speak to some of these issues. So Dr. David Epstein is going to speak first. He is the chief of the Real-World Assessment, Prediction, and Treatment Unit at the National Institute on Drug Abuse. He's going to speak about when to push interventions and what content to push. Next up will be Dr. Lisa Marsh, who's the director of the Center for Technology and Behavioral Health. And she's going to present on her research that led to the first FDA-authorized prescription digital therapeutic. We've had a change in our program. In your written program, it'll say that Bethany Hills is speaking next, but she had a last-minute conflict, so we are very fortunate that instead we have Aaron Josephson. He is the Senior Director of ML Strategies, a consulting subsidiary of the law firm Mintz-Levin. Prior to joining ML Strategies, he was a Senior Policy Advisor at the FDA Center for Devices and Radiological Health, and he will speak about legal and policy considerations surrounding FDA's approach to regulating software and other digital health products. Unfortunately, Dr. Daniel Smith had an unexpected family situation and cannot attend, but we plan on having a very full and robust panel discussion that will be led by Dr. David Barish, who will also moderate the discussion. And he is the Chief Medical Officer for the GE Foundation and Executive Director of its Global Health Portfolio. So please help me welcome Dr. David Epstein.